pelvic pain that just won't go away? Do you have a hard time eliminating your bowels and completely emptying? Do you have pain with sitting? Does your tailbone bother you? There might be a muscle that we're missing in that treatment called the coccygeus muscle. We're gonna go over some anatomy here so you guys can understand where that muscle is and why it might be causing you some troubles. If you look into the pelvic bowl here, you can see all the pelvic floor muscles. That's all the deeper pelvic floor. The very tiny little bone here is your tailbone. That's the very end of your spine, and a lot of your pelvic floor muscles attach directly onto it. One of the main muscles that we're going to talk about is the coccygeus. It has it in the name that it's attached to the coccyx, which is your tailbone. That is one of the deepest muscles here, attaching onto that tailbone. Here's the rectum, and the rectum sits just directly in front. If this muscle here deep in that pelvic floor is super contracted, if it is pulling on your tailbone from the side, if it is tight and it's not working properly, imagine how that would pull on the bone itself and cause you a lot of tension deep in your pelvis. Showing you this rectum here that sits right in front of it is just to reinforce that your bowels are right in front of that muscle and in front of the tailbone. If you can imagine the tension coming around the rectum behind it and just pulling and yanking on it, you can imagine that that would not allow your stool to completely evacuate out. When there's tension there, we can treat it in pelvic PT and let everything breathe, improve your bowel movements, improve your pain with sitting, and kind of open up that entire pelvic bowl.